Hello, everyone. Thanks for coming today. I want to tell you about a gentleman I know who lives here in Ohio. He is in his 60s, and he's been a smoker for over 40 years. He started when he was just a kid. And he's horribly, horribly addicted to nicotine. Although he's not been able to quit on his own, he's tried. He's had numerous heart attacks. They started when he was in his 40s, and that's when he quit working. He's recently switched to smoking, from smoking cigarettes to smoking little cigars because it's cheaper. They have a lower tax. He's been receiving Social Security, disability, and Medicaid for his mental health problems that are related to his smoking. So he's been putting into the system, or not putting into the system for a long time, but he has been taking out of the system for many, many years. We are here today to release the grades from the American Lung Association State of Tobacco Control Report. And why I bring up this gentleman's story is because it really brings to light what happens to the kids of Ohio, the addicted smokers, and our state Medicaid budget when we have the kind of grades that we have on our report. So without further ado, I'll show you our grades. We have an F on tobacco prevention and control spending, an A on smoke-free air, a C on cigarette tax, and an F for cessation coverage. One grade in particular that we saw plummet in Ohio past year was our grade on tobacco prevention and control spending. Last year, lawmakers drastically cut funding for tobacco prevention and control, leading to the loss of many nationally recognized science-based programs to help smokers quit. That could be helping that gentleman that I talked about at the outset, and programs also to help our kids not starve. One excellent program that was cut was programming by the Ohio Hispanic Coalition. Jesus, would you like to talk to us a little bit about the programs that were cut?
Sure.
I'd like to introduce Jesus Valles, who's with the Ohio Hispanic Coalition. And he's going to discuss how their funding cuts impacted their programs and the people that they serve.
Good morning again. My name is Jesus Valles, and on behalf of the Ohio Hispanic Coalition and the Latino community, I would like to discuss here the way funding cuts have affected our community and what we bring to the table in regards to tobacco cessation and prevention services. Research has shown that one of the main reasons that white Latinos or Hispanics do not seek any health care services is because of the tremendous language barrier. The same can be said for Latinos who want to quit smoking but do not seek any cessation program. They're afraid that they won't find someone who speaks their own language. So the Ohio Hispanic Coalition was one of the only agencies in Central Ohio that specifically provided tobacco cessation and prevention programs to the Hispanic Latino community, and the programs were both linguistically and culturally appropriate. The Ohio Hispanic Coalition had been given funds since 2005, and we have made a great impact in the community. I'm just going to give you some numbers of the people who have been impacted throughout the years, again beginning since 2005. In 2005, we reached out to 176 people, against both adults who did the tobacco cessation and youth who did the life skills training for. In 2006, we did 282. 2007, we reached out to 466. And we were just funding half of 2008, so we have those numbers. We had 276. So it's projected we did the entire year, it would have been like around 540 people we had successfully reached out to. So in about 3.5 years, we were able to educate and provide counseling to about 1,200 people. So that's a good number. And again, unfortunately, our funds were cut. So we no longer can provide those services to our community. 4 of our employees lost their job. And again, the biggest impact was we can provide these services for our community. So we still have people until this day, it's been 6 months, and we still have people calling our offices, so we provide tobacco programs and cessation programs, and unfortunately we have to tell them no. But we do try to refer them to other agencies that are providing services at this time. But when we try to follow up with people, we call them about 2 or 3 weeks later, and we would get the feeling that they don't it's kind of difficult. Again, we work with a lot of the school districts here in Columbus as well, and Southwest City Schools and stuff like that. And what we provide our life skills training and, for the ESL programs. Of course, we have a large need in that. And, again, we have to just kind of turn them away, not turn them away, but kind of tell them, we can't provide the services now, but again, we do the referral system and we provide that to them. But it's kind of been difficult. Our community does need this type of service, and unfortunately, we can't provide it to them because of the lack of funds.
Another very vulnerable population in our state is our youth. As I talked about with the gentleman's story that I said at the beginning, most lifelong tobacco users start before the age of 18. So it's very imperative that we get prevention messages to our kids. Here to talk about the Loss of Youth programming is Kyle Peagley. He's a senior at Edgewood High School in Trenton, Ohio. He's also the president of IGNITE. It's a national anti-tobacco youth prevention program.
Thank you, Shelly. Good morning, everybody. Like Shelly said, my name is Kyle Peagley. I'm 18 and senior at Edgewood High School and also the president of IGNITE National. At age 11, I started with tobacco control. I actually got involved with Stand right when they were starting out, kind of a new organization. And I helped basically start a lot of the things that Stand became. We used to go out to local schools and spread prevention messages to our youth, who may not receive that at home. Once the funding has been cut, we're not able to go out into the schools anymore. We don't have that motivation and that lack of advertising that we once had to help spread the message to the corners of the state that, may not be as, urban or, get those messages as much. So with that, when we went out into the schools, like I said, we would spread those messages, and there wasn't a kid that didn't know the Stand logo. When you showed that to them, they would exactly tell you what it stood for. It stood for not smoking. And, with the tobacco companies increasing nicotine in products that are targeted towards youth, and of course, there are deceptive advertising that they have at all grocery stores and your local, convenience stores and basically retail chains. Those are at the eye level to the youth. And so, without a prevention program that is helping them, to get the message to not smoke when they go, it's basically an unfair battleground. The tobacco companies are going to win without a doubt because they don't have those prevention messages anymore. In 2006, Stand was actually awarded the Group Youth Advocate of the Year Award from the Campaign for Tobacco-Free Kids. Every year they rank groups and individuals around the nation as far as their efforts in tobacco control. And in 2006, Stand was rated #1. Nearly 2 years later, Stand became non-existent due to the budget cuts. So we went from being top in the nation to being nothing at all. And I know that parents do tell their kids not to smoke, but unfortunately sometimes they don't reach them at the young ages that are needed to be reached. We were able to reach out in middle schools, even like the young 6th graders who were just becoming, youth and maybe beginning to being targeted, not by the tobacco companies, but also by their peers. When I went to the skating rink at age 11, I saw people that were 12 that began smoking, and I just absolutely thought it was outrageous that these youth were starting such a deadly habit at such a young age. So given that, when we went out into the schools, this helped that drastically. And like I said, my involvement with IGNITE, it's allowed me to travel to over 25 states in this great country. And I've seen the states that, have the great tobacco prevention programs and those who have struggling ones, and then those like Ohio now have none at all. And, studies prove that in states that have great, tobacco prevention organizations targeting our youth, those are the states with the lower levels and kids starting tobacco every day.